My name is Dr. Greg Gillespie. I practice dentistry in Vancouver, Washington at Gillespie Dentistry with my brother, Dr. Brad Gillespie, and my cousin, Dr. Dennis Gillespie. And we took over for our dads, Dr. Steve Gillespie and Dr. Rich Gillespie. So dentistry is in the family. I went to school at the University of Washington, and I have been a dentist now for 15 years. You know, it's interesting. I think that charitable service is something that we all innately want to do. And the moment that we can have an impact on somebody else, just out of straight the goodness of our hearts, then we realize that impact that it has on us. And then you just want to do it more and more and more. Who doesn't want to be a part of this? You know, access to care is an interesting thing. I actually had someone this morning ask me about access to care, and if we thought that, if I thought that more people needed to have access to care. And the answer is 100% yes. The access to care issue isn't just a geographic problem. It's a problem financially, it's a problem culturally, it's a problem societally. I mean, we have issues with people getting into the dental office, not to mention the fact that people have a misconception about what dentistry is like and what dentists are like. And so access to care issues is a big scale. And unfortunately, you know, being a dentist, you hear a lot of stories, and you hear negative stories about people who were impacted when they were young, and then they don't go and they get that care regularly, and so it leads to much bigger problems, and then their anxiety becomes bigger and bigger. And so, you know, when you think about access to care that way, they are self-limiting because the problems just seem too big to fix. You know, the advice that I have for anyone who feels helpless with their teeth is that you're not helpless and you're not hopeless. We as dentists, myself, we can help you, and the impact that it will have is so much bigger than you can imagine. You know, I've been able to do a number of these cases, and I would say 100%. Every time we get done, it's the big hugs, right? The smiles are so big, and they didn't realize the impact that it had. I do a lot with smiles, and I talk to the patients, and they say that, you know, they didn't realize how much they had been covering their mouths or smiling in pictures like this because they didn't feel confident about who they were, and so that came out sideways in their smiles, and so it affected them so often in ways they never even understood. And then once their smile was better, they were like, their eyes lit up, right? Who they were inside was coming out more and more. And to think that we could do that through dentistry, you are not helpless. We are ready to help you out. Could you even imagine if there were thousands of dentists who were involved in this? I mean, let's finally turn the narrative around on dentistry, that we can make an impact for good on the community, on people's lives, that people understand the role that healthy teeth make. I mean, in your lives as a whole. Imagine if thousands of dentists were doing this. I mean, it would change the way that people felt about dentistry, and it would change the way that dentists felt about other people. I mean, getting involved in this is one of the best things you could ever do.